Good morning, everybody. I'm Rick Friedman, a recovering Fed. I retired from CMS back in December and still managed to stay involved a bit. So this morning's session discusses real-world examples from a national perspective, from a state perspective, and from the county's perspective. As Daniel pointed out, these are really just 3 examples, and there's lots going on in your own worlds, we're sure. But I think it really provides a nice overview. They say that good authors write the last chapter first and then write backwards. And I think about this conference, Symposium, that when you're on the plane going home or driving home or walking home, however you're getting there, it's worthwhile thinking about what is the end. What is it that we're really trying to achieve, and how do we get there? And to start thinking about that before you get to the end. So that yesterday we spent a fair amount of time talking about the as-is world. And today I think we want to turn our attention to the to-be world as well. And one of the ways to think about that is, as we listen to the speakers this morning, what are some of the issues that they've raised that we need to be able to write down and pay attention to based on their experiences that others really need to address in the future? So that at the end of the symposium, as we're working on this laundry list of what 10 years from now might look like, and what are the steps that we need to take as a group in order to get to that to-be world, it's based on the reality of people that are actually on the front lines today from a national perspective, a state perspective, and a county perspective. So I think it's worth trying to listen very carefully and take some specific notes that will help us in tomorrow's conversation when we start talking about what does that world look like, and more importantly, what are the action steps that we would recommend that the feds take and that we take in order to get to the world of interoperability that we're really after. So there are 3 speakers. You should, at another time, read their bios. It's very impressive. But in the interest of time, I'll just say that Olivia Golden is currently an Institute Fellow at the Urban Institute, a former Assistant Secretary for Children and Families for 8 years with the Department of Health and Human Services. She has also held senior level positions both in DC and New York State. Dr. William Hazel, Bill Hazel, is an orthopedic surgeon, and in his spare time is the Secretary of Health and Human Resources for the Commonwealth of Virginia. Living in Alexandria as I do, I'm especially grateful that Bill is the Secretary for Health and Human Resources in Virginia. He's held many positions, one of which was he was the former chairman of the AMA's Council of Legislation. Major players across the country. We're really, I think, blessed in having Carrie Hoff with us from San Diego County. I remember going to a California State Fair, I think around Y2K times, in which every county was like a science fair, a card table set up with who they were. And San Diego County said that it was bigger than a number of states, just in terms of its population. I think it's about the size of Connecticut, if I'm not mistaken. 3.2 million people in one county. Carrie is the Assistant Deputy Director with the San Diego Health and Human Services Agency, and she manages a service delivery integration project that builds an electronic information exchange between health, social services, and justice. What could be a better connection? Olivia?
It works. Good morning. I'm thrilled to be here. When I got up very early for the early morning train from DC today, I thought, why exactly did I tell Daniel I would do this? And then I realized there were many answers, and one of them is the panel that I have the chance to be on with. Another is this extraordinary group, the mix of state, county, I think there are some federal officials still here, I know there were yesterday, and private sector and nonprofit partners. And then the third reason is the timing. This is a moment when talking about the Work Support Strategies Project, which is a big project I'll tell you about with foundation funding and 6 states, is exactly right, because we're finishing a year of planning and design, moving into an implementation period, and it's a great time to talk about what we've accomplished, or what the states have accomplished, what we've learned. So what I'm going to try to do is spend about half of my time telling you what the project is, and about half on what we think we've learned from it. So what is the Work Support Strategies Initiative? I note that there are people in the audience. I was just having the chance to chat with the Rhode Island crew. I think we have colleagues from Illinois and perhaps some of the other states participating. So after I finish, you can tell me whether I've said it right in terms of a characterization across all the states. When we began, the goals of the Ford Foundation, which was the lead funder, the Urban Institute, Center on Budget and Policy Priorities, who are our key partner, our goals started with families. And they started with the idea that low-income working families who desperately need benefits like Medicaid, child care subsidies, food stamps, SNAP, to stay stable, many of them don't get those benefits. And so the goal was to increase the share of eligible families that get and keep those benefits and thereby stabilize their lives. From very early on, we also had a goal about states, which was that states would be able to more effectively deliver services and reduce the burdens on state workers as well as families. And from the beginning, we also had a goal, which is what I'm doing today, which is to try to distill lessons from the experience that we could tell and find useful for other states and the federal government. Key components of the project at the very beginning, when we started with a request for proposals from states in 2010, we specified that all states had to be paying attention to integrating Medicaid, nutrition benefits, SNAP, and child care subsidies. We picked those. I'll come back to that a little bit later, but because we read what we thought the research told us was that those were particularly crucial for family success, and we left open for states the option of adding other programs, which almost all of them have, as they've operationalized the idea. And I won't say much about the components except to say that from the beginning, we alerted states that we thought this was complicated, and that if you wanted to have an impact on families, you were going to have to address policy, technology, business process systems, and pretty much everybody has found that to be true. And I said this was the perfect moment. We're now just at the end of a one-year planning period, planning design, very action-oriented design period, a lot of piloting with 9 states, and we're just beginning a 3-year implementation period with 6 states to be kicked off by a conference next week in Washington, D.C. And the 6 states, as you can see, are very diverse in their politics, in their size, in their region, in urban and rural: Idaho, Colorado, South Carolina, North Carolina, Rhode Island, Illinois. So that's a whirlwind tour through the what of the project. What is it? I want to spend a little bit of time on why, and the reason I want to spend time on why, some of the reasons will become evident as we keep going, because I think that really understanding what Jerry Friedman was just describing to me as the problem you're trying to solve before you create the solution is really important. But another reason for spending time on the why is that at the very beginning, when we went out to see if states were interested in working on integrating these programs, a lot of people told us we might not get any interest. They said it's a time of extraordinary budget and political pressure. Nobody is going to want to try to work on poverty-related work support programs. It just means more benefits going out the door. In fact, we got 27 applications to that first RFP in 2010. So why was that? What have we learned about the reasons? Well, as I say, we led with the benefits to families. That's what motivated our originally getting started. We did a literature review to try to understand what research is out there to tell us whether having a package of work support programs really does stabilize families. The research isn't very extensive, which is one of the reasons we think the evaluation from work support strategies will be important, but it does suggest that stably receiving these benefits helps low-income working families stabilize at work, move up, and help in other parts of their lives. But in addition, we've really learned a lot from the planning year about the benefits for states, the reasons that states believe these projects are important. And one of the very early things we learned was that we had wondered if anybody would be interested in a time of budget crisis. In fact, what people said to us was, this is the time we have to do it. And they talked about the perfect storm. I'm actually not sure which state came up with that. Maybe somebody here will take credit. But with the recession and its aftermath, big increases in family need, reductions in staffing in some states because of layoffs, in others attrition and lack of hiring. As a result, huge backlogs, crowded waiting rooms, voice mailboxes of social workers filled up to the brim, and just creating an ever-worsening cycle as families couldn't get in the door, let their benefits lapse, came in again, called 5 times, and it just got worse and worse. And so states thought that they couldn't continue to do business the same way. They had to streamline. And as we got further into it, and as states got further into it, realized that streamlining across programs offered some benefits even greater than within a single program. For example, if your pay stubs can serve a purpose for verification in 3 programs, that's not just good for the family, it actually streamlines the work the state has to do. That's just a sketch I made when I was making this case to the 2 workers in North Carolina. But as we got deeper into the planning process, what we learned was that states also found other value in this work. And while none of these themes is characterized in exactly the same way across all 6 states, some version of them is very appealing in a number of states, and I think they're really interesting. So first of all, good government. We did a panel 2 weeks ago at the Urban Institute with cabinet secretaries from 4 of the 6 states. And Secretary Delia from North Carolina, who is going to be on this panel today, working for a Democratic governor, and Director Richard Armstrong of Idaho, working for a Republican governor in a state where, as he puts it, Democrats are an endangered species. Both of them said that getting rid of citizen complaints about how the process was working and improving, really achieving an image of what good government ought to look like, mattered to office holders in both their states. In fact, Director Armstrong's line was, what the legislators wanted from me, they wanted the complaints to stop, and they wanted to get the credit after I fixed it. And then he waited for a beat, and he said, but of course they deserve the credit because they funded fixing it. So that actually was a very powerful theme. Program integrity, that if you're doing your work better, simplifying your policies, not only are you reaching more of the people who are eligible, you're not making as many mistakes. And then readiness for health reform, another, which I know you've been talking about. Another thing that we wondered when we put out that RFP in 2010 was whether having health reform now be part of the picture, which it hadn't been when we started discussing the project. Would that mean nobody would be willing to embark on connecting Medicaid to human services programs because it would just seem too difficult and too unknown? Well, I think that's true for some states, but those states that chose to engage in this project actually saw it the other way. They saw health reform as a big motivator. As a motivator because they knew that getting hundreds of thousands of new families onto the Medicaid rolls in 2014 was just going to be totally impossible in their old paper-driven process, so fixing the process was important. And then, as the federal government not only put the 90-10 money out, but the 3 agencies signed the letter to say you can use this money in ways that will help your eligibility system be integrated, that was a huge motivator for many states, including some in the room right now, and gave them deadlines and dollars to plan how their system systems were going to fit together. And again, in some states, including Idaho, as I say, the reddest of red states, even though health reform is not, you wouldn't use those words there, the vision of customer service, that's a vision that's non-bureaucratic, streamlined, people don't have to jump through a lot of hoops, that's turned out to be very popular there. Finally, one more lesson about the why that has been just fascinating to me and I think may be useful to other states. One of the things that states found as they plunged in during the planning period to analyzing their data was that fixing churn had very powerful benefits and was a really strong reason to focus on streamlining. What do I mean by churn? Well, if you think about, first of all, from the perspective of families who don't get the benefits they deserve, there's a tendency to focus on the front end. How do people get to the system and get their applications in? But even when we began the process, we knew from some of the national research that for families, losing benefits is just as big a problem as not getting on in the first place. When I was in New York State and we were working on getting Medicaid to all children, we realized that what we had, as one of my colleagues said, was a bucket that not only had a hole in its bottom, it hardly had a bottom. We were bringing in huge numbers of children and then losing them because their families moved, whatever reason, at redetermination, they dropped out. Well, what the states learned during the planning period for work support strategies was that that's not only a big burden for families, it's a huge burden for states. Because if somebody doesn't get their redetermination, doesn't get continued, but they're eligible, and then 3 months later, when a crisis hits, they come back in, and you have to do the whole process from scratch, that's an enormous worker burden. And many states found that those packed waiting rooms, those filled voicemail boxes, a lot of that was people coming back because it hadn't worked the first time, and then calling in a panic 4 more times because they didn't know how to solve their problem. So that's turned out to be a big motivator for states, and again, a cross-program perspective has turned out to open windows into solving it that states didn't have within just one single program. So I said I'd spend at least a chunk of the time on the lessons, and I'm glad to come back to any of that information on what the project actually looked like, but I want to get a few of what I think are the emerging insights out there, and I want to note that while I ran these by our Director of Evaluation, they're all illicit and my early ideas, because our report isn't coming out till September 2012 on cross-cutting lessons, so you should all look for the report. First lesson really is what I've been building up to all along. There are powerful motivations that are leading people, even the lawyers that somebody was talking about, to want to improve the way services are delivered, even in tough budget and political situations, and sometimes because of those. Sometimes when you try something new, you discover that it gives you a way to handle the problem, excuse me, that you hadn't thought about in the beginning. But the partner observation is that large-scale innovation is very, very hard. The time has to be right. You need the right constellation of political leadership, career leadership, resources, potentially technology. You need a bunch of things to be there, and you can overcome some gaps, but it isn't the right moment everywhere at every time, and it's extraordinarily complex. I was just on the phone yesterday with the project leaders in our work support strategy states, because I'm going to be doing a panel with them at our conference about what they learned in the planning period and what they're scared of, worried about, concerned about in the upcoming 3-year implementation. And the range of insights about the challenges that they partially learned how to deal with in the planning period was extraordinary. One person said to me, you know, it's the people that are hard. And she's in a state with lots of local offices, lots of challenges in, you know, huge attrition, layoff, union, resource challenges, a lot of bitterness and morale issues for very understandable reasons. Another person said, keeping the momentum up, everything, we've got so much on our plate. Another state, has huge history going back 20 years between the human services and the health agencies, the federal government, the question of if no matter how good a job we do, it's very, very complicated. So what do you do about complexity if you want to succeed? These are some themes, again, as I say, my own first culling of the themes. When we get to the fall, we'll have more to say. The first one is that complexity requires focus. And what I mean by that is that to solve one of these problems, you have so many layers. You have so many stakeholders to talk to. You have so many systems to figure out. You have so many problems that you didn't even know you had till you started, that you really need a focused picture of where you're going. And the work support strategies picture, we're trying to support low-income families so they can stabilize at work, and we're trying to accomplish these goals for the state, that worked in these particular settings. It might not work everywhere. So that makes me a little bit, I think, where Elizabeth was in her question about whether interoperability works as a way of engaging people. I myself am not actually enthusiastic about a broad word like integration or interoperability as a goal, though in some of your settings it may work. To me, you're going to have to characterize what's the problem you're going to try to solve, what's the win you're going to be delivering, and that gives you enough focus to work through the challenges. Complexity requires success along the way. We've all thought about early wins. You're going to need people at the table for years if you're going to solve complex problems, but they're not going to sit there just doing process, so you need wins. And a lot of people talk to us about the way they're pilots. In one of the states, somebody said, you know, she knew she'd gotten progress with her local office directors when the one in the pilot office was sitting in a meeting with all the others, saying that the innovations were starting to pay off. Her phone beeped. She looked at it. She said, you know, my second in command just let me know that our waiting room is empty and it's 10 o'clock in the morning. That was the early success that got her motivated. Culture of learning, we can come back to that in the Q&A, but we did a lot of work with data in the planning period. And I would say to you, I'll let the states here comment on whether they think this is fair, but yes, the quality of the data matters, but even more of an important first step is getting the approach, values, and support in place to actually use whatever information you've got. Because in many states, there's not right now a practice, a habit of actually using information to make decisions. And finally, technology is important but not sufficient. It's important, among other things, because it makes problems soluble that 10 years ago, 20 years ago, posed impossible choices, like do you offer families lots of services in one place so they can get the benefits of all of them at once, or do you offer them at many different locations that are convenient to different people? Well, now you can do both and not have to choose. I wanted to close. Daniel's suggestion was we have many partners in this room who would like to help, who would like to be there for states trying to do these things. So what do I think are the important things to do? And I'm looking at Deb, who I know will have 100 ideas as soon as we finish the panel from Rhode Island. But I thought I would offer a little bit of a characterization of what I think we've learned from our year. Let's see, this is fancy. Somebody else did it for me, so just this slide. We had a wonderful technical assistance partner in the Center for Budget and Policy Priorities in Stacy Dean, and they developed a wide array of strategies, one of which was peer learning. And what I want to call your attention to here is some of the words, those are quotes from some of the states in the project, about what they got. It's not just lessons, although you can see resources and don't invent everything, but you'll see sense of hope up there. You'll see taking the fear factor away, and you'll see moving forward with moving skeptics. So what state innovators need is a lot of different kinds of support that help them see a vision, have hope, learn, and counter skeptics within their own organizations. So taking that idea, people do actually want help with their vision. They don't want a vision imposed, but they want to understand what's possible, who else has done what, and they want technical assistance, practical tools. including, and I think it was Jerry who mentioned this in the early questions, support with leadership. That's actually one of the things we found, is that even the most senior leaders in the states value the chance to debrief with somebody. It can be pretty lonely being an agency head in a state without that opportunity. The other thing I want to highlight, I don't know if you noticed in that early slide where I told you about the planning and the implementation periods, the foundation-supported grants to states in this project have been relatively modest compared to the billion-dollar budgets, $250,000 a year in the planning period, $500,000 a year in implementation. But that's been crucial. What people have said to us is that it gives them the capacity to have essentially somebody full-time who's looking beyond the crises, some help with data, some ability to get training. You really need some way to lift yourself above the day-to-day work in order to seize the moment. And that's been able to leverage billions of dollars in federal money as states and state money as states then become able to seize those opportunities. It's also been very important to states to have knowledge exchange with the federal government. You're doing some of that here today. We've started. We're hoping to do some more. Federal agencies are stuck for travel money. They're not getting out as much as they want to. So on both sides, people want to understand what's happening. At the same time, and I don't know who we have from the federal government here now, but I do want to note, speaking as a former Fed myself, that there are clearly incredibly important roles for the federal government. The money, including not just the money for the systems, but the benefits, so that when you increase having people on SNAP, you're not paying for it out of your general fund. Policy clarity, removing roadblocks. And then the last one that I wanted to close with, having the feds as a bad guy is not a bad thing when you're a state innovator. It's a bad thing if they do it around the wrong issues, but we had this panel of state cabinet secretaries at Urban a couple weeks ago, and I asked everybody what motivated them to get going on their work on streamlining. Every single person had a story of how what motivated them was understanding how badly the system was working now, and at least 2 of those 4 stories involved a letter from USDA. The others involved complaints. I mean, they all involved multiple things, but really grasping early on in a secretary's tenure what is and isn't working, or later, can be a very galvanizing event to create change. So just to let you know, it's a work in progress. There are some sources for learning more. And I was thinking, it's interesting, Rick reflected on going to the end of the book and then writing backwards. I was actually having the opposite reflection as I was thinking about this. I was thinking, you know, I read mystery novels a lot, and bad mystery novels, I just want to jump to the end. The result is the only thing I want to know. But good ones, I'm caught up in the drama along the way. And I guess what I would say is that I hope your work on reform is like a good mystery novel where the ending really matters, but what's crucial is that you stay engaged and learning at every step. There's no cookbook for this. I guess I'm on a book theme. It's something that you invent as you go along. So congratulations on all you've been doing, and thank you for having me.
Thank you, Olivia. I know about this making it up as you go along stuff. And my job today is to talk a little bit about the journey, I think, more than the end points. Although I would say at the outset that I come into this as a recovering orthopedic surgeon. And where the first meeting I had with the folks who were left, this was in January of 2010, with the folks who were left, I got in sworn in on a Sunday, and on Saturday morning we all met in the Patrick Henry building. Please note that I work in the Patrick Henry building. Because of that, I have some interesting perspective on things that other states might not fully understand, you know, but it might tell you a little bit about where Virginia comes from. So you get who's left, which is generally a classified employee from the agency or 2, because we ask everybody to bring the top 2, and my deputy, Matt Cobb, was there. And what we were doing, session's already been in there for 2 weeks, and you're sitting there and you're saying, all right, what are your problems? And I said, this is not my orientation. We don't have time to orient me now. I just need to know where the problems are. You know, we're going to, and you go around the room, and the first thing we learned is that VITA is a 4-letter word. Now, VITA in Virginia is the Virginia Information Technology Agency, which is now about 7 years old, which had been established as a partnership between the state and a vendor to create and sustain the IT infrastructure. And as of that point in time, it wasn't working out quite like everybody thought it would. So not much confidence in the Commonwealth's ability to implement anything related whatsoever to information technology is going on. But the next thing you hear about is budget. And somebody from across the room over said, Dr. Hazel, he says, we've been cut to the bone. And I said, isn't it funny they sent you an orthopedic surgeon now? I hadn't actually thought about that till that moment, and then you start hearing the individual problems, and the immediate reaction as of someone who's been interested in health and health care is that the criticisms that I was hearing, the self-criticisms and problems, reflected what we always hear about us in medicine. You're fragmented. You can't access the system. You go to one place, and what happens, you get sent there. And then when they can't help you, you get sent there. And in medicine, Dr. Teisberg, Elizabeth Teisberg at UVA calls it patient pong. You know, we send folks around. And having, those of you who've endured the story of my mother's medical adventures over the years with my help knows of my frustration with the system. And the system we have in healthcare, and by the way, in social service, are parallel. There's a lot of, you got to go there, there, and there, and there's always this stack of papers you have to fill out that always ask the same questions. And it's, don't you people talk to each other? And so the goal is to get away from that, and as we try to fix the healthcare system, try to, in a similar way, involve the social service system, which in the public sector is not different. It's supportive. They go together, where physical health, mental health, food, work supports, and all these things have to go together. So how do we get this coordinated in a way that's meaningful? And to do that, you have to turn your workforce, which is in Fairfax. Pat Harrison is from Fairfax here. I have Don Driver from Rockingham. I mean, they'll tell you, our offices have been overflowing with people in Virginia prior to coming in. SNAP benefits are up from just under 600,000 to over 900,000. Last week, we had, I think, 200,000 more people on Medicare than we did 4 years ago. We're processing 2.3 million applications a year for those programs, along with about a 16% error rate. That's at one point on these, because it's not an organized process. So the challenge is getting there. Now, that being said, the job is, so what do you do? The journey is, how do we get from where we are to where we want to be? And I can't say that we sprung into this organization automatically and knew exactly what we needed, because coming in, we had to find our way around. And so we have this problem, and the first thing I want to do is I want to introduce you to Dave Mix. Dave, stand up. Dave is a longtime DMAS employee in technology. And he comes to me after hearing me talk, and we had been working on Health Information Exchange, the other HIE, in meeting the ERA requirements, and we had something called the HITSAC, Health Information Technology Standards Advisory Committee. We had the High-Tech Health Information Technology Advisory Committee set up under the previous administration. I was part of that. And so Dave comes to me and says, Secretary, all this stuff we're doing on the health side can be transferred to, it's the same model, human services, and there's this thing called MITA. Tell me more, Dave. And so, he started drawing me these pictures, and when I show you pictures later, they are in Virginia known as mixtures, after Mr. Mix, who puts them together for us. So we don't do the cartoons, we do mixtures. So Dave, as the director of the MITA program, has moved this through, and what we found is we had lots of ends pulling us from the center, so we created created, it was envisioned in the beginning, but we had to get the funding in place and the support, so we created the EHHR program office. And Larry Reed is there. Larry is a contractor with CACI to stand up, and Larry is the one who actually week to week manages this. And we've hired Mike Worth, and I understand everybody here knows Mike from the old days. And Mike, we have hired to be sort of my special advisor for information technology and business process redesign, because they go together. We can't do one or the other. And then I have Deputy, I mentioned Matt Cobb earlier from the beginning. Matt is a lawyer. He's one of the good ones. That's why we don't take the Shakespearean approach to lawyers. We need the good ones. But Matt is here today, and the way it works in Virginia is after I leave this afternoon, he will tell you what I meant to say. So that's how it works. So we have sort of the goals, which I think we've all, I won't read the slide to you, but how do we take advantage of this opportunity that health system reform, 90/20, the demand that's driven in terms of care of our customers to deliver our services better. How do we put this through to make it work? And we have chosen, as you said, I think the question comes up, we've got to remember that the customer's in the center, and the customer is in the center. And these providers here could be medical, could be mental health, could be social workers, but how do we turn our social service people from eligibility workers into folks who are helping coordinate care and ensuring that people do get the full benefit as it's designed? How do you make it work? And then hopefully how do you transition them out of those taxpayer-supported programs so that it's not a permanent situation? This is the first mixture I will show you. We went ahead last year, and this is where our esteemed leader, Mr. Friedman, had a lot of help working with us. We decided that we were going to make the entire Health and Human Resources build it on the MITA, basically, Medicaid Information Technology Architecture. So to do that, we had to buy a lot of stuff. We had to buy a service bus, enterprise data management, rules engine, and we inherited a project to build a customer-facing portal in Virginia for child care. So what we were able to do, we had the ability to extend the contract by 25% in Virginia without rebidding it. So we extended this contract from child care to include child care, Medicaid, TANF, LIHEAP, and SNAP. I think I got them all. And so that, I will tell you, I'll show you in a slide in a minute, but yesterday that went statewide bidirectionally so that individuals can apply online and get information back. And I will tell you, a lot of the work that made this comes from Pat's shop in Fairfax, because Juani Diaz, one of her people, has felt it's very useful. And even in our soft rollout period where we only had one-way access, I think they processed over 2,000 applications since March when you first got it, or April. You got it in April. We got it in March, yeah. I mean, unbelievable work and acceptance there. Now, some counties have waited for technology support and so forth, but Fairfax has barreled right into this and demonstrated its work, and it works. But our goal is to have a citizen portal, and this allows us through the SOA architecture, the SOA framework, to tie in legacy systems. So what Dave's original mission was with MITA was to tie all of our legacy systems in, and we'll show you a little bit more of the details. Now, where this fits into healthcare, and why my comment yesterday was, remember, the main thing is the main thing, and that is to get the systems in place and to tie together the enterprises. This is how we envision health benefit exchange tying into our system. We have a citizen portal that we can use and will use for applications. We have an RFP out now to replace our E&E. We have an ADAPT system. It's 20+ years old. The VITA fees alone on that are $17 million a year. That's where the savings come from, upgrading the architecture. We also believe we will exceed with health reform, if it happens, 425,000 individuals coming into Medicaid, another 100 and some thousand coming in initially for our health benefit exchange, and we anticipate cost avoidance of up to $40 million a year in terms of what we would have to hire to staff the offices to do the eligibility determinations. Then you put 90-10 money with this, and you give yourself a good way to go. So we want to do the eligibility if we have to do it. And I say we remember the Patrick Henry building. I'm going to forgo all the rest of the discussion about health reform there. But this allows you, through our system, our brokers and navigators and call centers can be managed, and we can hook through the modules to CMS and so forth. We believe we can tie those in, create the portals if need be, and that is indeed our project with our eligibility system. Now, I mentioned the web. This is what was up yesterday, Common Health, and it was big. I understand it went fairly well. I don't know how much utilization we had on day one, but this can be accessed from home, from a library. The folks who do consumer assistance in states can access this and apply for the benefits, and when we can manage child care utilization through this portal. That's really where it started. And our vendor on this was Deloitte. It's borrowed from the public sector software, Michigan Bridges. I would add another thing. We want to get information out of the system. Olivia mentions issues related to fraud and abuse. That's a popular topic to talk about in Virginia. We got to eliminate the fraud and abuse and the errors and those things. So that's something everybody kind of gets behind. So we envision an informatics layer. This is a slide borrowed from a vendor, SAS, and Joan Ohl from the Casey Families Foundation is here with us at this meeting. Joan, you can raise your hand and be recognized. She was with ACF under Bush's my position in West Virginia prior to that. So Joan with Casey has come in, and they've provided funding for a vendor to look at our various databases, and we have picked up information from Oasis, which is Children's Services. We have CANS, Child and Adolescent Needs Scores. Financial data from 7 localities has been put in, and we got a preliminary, I think it was the week before last, look at our data so that we can begin to know how we are doing comparing a child, a basket of services, and an outcome. And this is a work in progress, and I just got the email this morning. We're scheduling the final presentation, Joan, on that. So we are looking very much at how we get some accountability put into it through our system. Now, there are challenges, and this is, I think, what Daniel wanted me to get to. There's governance, program management. I'll let you read the slide. I'm going to go through these things. So going back to governance, we have, hey, Mike, I'm William Hazel, not Williams Hazel. It's Johns Hopkins, but it's William Hazel. I just noticed that. That S shouldn't be there.
You get an honorary degree.
Yeah, so we have this project of ours across the Secretariat, it's Health and Human Resources, and we look at this as the money is coming in through Medicaid largely, the 90-10, so we are sort of the customer and the boss, if you will. We have a Secretary of Technology, Jim Duffy, who's been very supportive. Then we have Sam Nixon's Chief Information Officer. Sam works for Jim. Sam runs BETA, and this has been a very, very good collaborative relationship. Cindy Jones runs Medicaid. Many of you know her. Martin Brown is our Commissioner of Social Service. Now, Richard Holcomb, Department of Motor Vehicles. What on earth does that have to do with this? Well, the answer is in Virginia, DMV knows who you are. And what's more, you've given them information voluntarily that they can share with us to help us create a database so that when you come in online, we can identify you with some degree of reliability when they share theirs with us. We can't today share our social service information with them, but they can with us. So they are the ones who are really helping us build our Commonwealth Authentication Service. And we look at this as something that they will use when they are able. And so we're not building anything here that can't be expanded to other areas of the Commonwealth. And then we had Rich Slowoski from General Services. They do most of the procurement in the state, how they work. Now, this is not a mixture, actually, but it's sort of designed to shows what we're doing program-wise. And we have the program. I chair the Oversight Committee, which has these multiple agencies that are involved. I will also tell you the Auditor of Public Accounts comes to those meetings. The Attorney General's office is represented, and the Program Oversight Committee meets monthly now, so that we really can talk about it. And Larry and the guys provide us with a list, an agenda that we go through regularly that hits all the high points. I won't read through these, but these are a list of some of the sub-projects that we've got going that all tie into this, and it is tricky. Now, it's not random. In the process of this, we formed an IT strategic plan. And the question about sustainability comes up. I'm 2.5 years basically through my term. We're a one-term administration. Odds are I'll be gone. And people say, well, it's all about the executive sponsorship. So you have to move it out of personality and into sort of the institutions that we have. So we have a strategic plan. This is a new agency head work profile that we're implementing, and all of my agency heads are getting right now this, and this will allow 2 cycles of employee evaluation before we leave. And I don't know if here's strategic operations, advances strategic programs right here, the management that we give them, but you'll see HHR dashboard, Virginia performs, all HHR approved strategic plans is in his job description. And down further, there are some 5 administrative functions that every agency head has, and they're designed to cut and paste. There's one for finance. He's to cut that and give it to the finance people. There's one for human resources that he's to cut and give to human resources. That, by the way, says that everybody's job descriptions in the agency has line of sight to the goal. But the IT goal is implement the strategic plan. So what we're trying to do through this is to get this drilled down into everybody's work description, that we do have a plan, and if you're touching IT or business processes, you will be tied to this strategic plan going forward. And this is dynamic. And we will be, it's 6 months old, 7 months old now, and we will be revisiting it shortly, because in this agile process we're working in, it has to be updated. Now, obviously, we have the new office that we've created. That is being funded with Medicaid and 90/10. We're using best-of-breed Vita services, and I can go through all of these things, but we are building a center of excellence, which we didn't have in the Secretariat around SOA. We didn't have that technical capacity, and also around enterprise data management and data stewardship. And that's been an issue. Now, as far as the data stewardship, I'll tell you one of the big challenges is everybody who saw something 10 years ago remembers that as being the SNAP policy. And even though they've changed, there's always this nagging thing in the back of our minds that something is not right. So we are working with the feds to try to get it worked out. And this is where Joe Bodmer is helping by creating a grid of what is actually expected and allowed regarding federal use of data. Data standards. The previous administration set up Health Information Technology Standards Advisory Committee. We don't create standards, but we adopt best practices. For the most part, their mission was extended to set the data standards for, and this is the sharing standards really, for human resources. They've been busy. For data, we are going to govern, if we get this pulled off, we are going to govern our data sharing by a DRSA. A data use reciprocal support agreement is what we would have, and we will have the DRSA that all of the agencies that want to participate will have to sign, and it is sort of a self-administered group. So if you don't follow the standards, your agencies can't use it. So we can't create a single organization, but we can sure integrate it virtually as best we can, and this will be one of our governing documents. Now, we are now at the second draft of this. The goal is to have it complete mid-July. Then we're going to compare it with the federal data use requirements. Then if we need to do anything with Virginia statute, we will plan to bring that in this session. The program, this is actually more like a mixture, Dave. This is it's complicated enough. The other ones were just kind of scaled back, but this is all about security. We haven't, and I'm not going to read security to you, but we are looking at sort of the best practices in security right now. And the success, obviously, there's multiple levels of leadership here. You have to have a project management office that really works, and we are staying on top of it because you do have to create some confidence in it. It's not just the technology, they're the business processes, and we do have a lot of concurrent work streams. And what I would say is this is iterative. We have gone historically from a waterfall process. You get one thing done, and then you go to the next thing, and then you go to the next thing, and we are doing multiple things simultaneously. So it turns out it's a bunch of small steps and allows for mid-course correction. I think it's a preferable way to move things. And then there's, of course, the education and partnerships. And here's the timeline, folks. Again, for us, the funding comes from the Medicaid, so they want us to be ready for the eligibility modernization. That becomes a critical step for us. But as we go through Consumer Portal out yesterday, on time, under budget, health information exchange we're building, we can now do direct protected health information exchange between providers. That'll go into a more interoperable state later this year in pilot, and we will use our customer or consumer authentication service for the health IE, or the health information exchange next year. Then we work on out into the expansion years. So that's our timetable that we've set up, and we'll see. But thank you. And now you get to hear from Carrie from San Diego.
All right. Hello, everyone. Thank you for being here, and I have to say I'm humbled to be on this panel and here, and I want to share with you the San Diego County perspective, but really, you know, this is a learning environment. So, you know, what I'm sharing is part of a conversation that I hope we can engage in over the rest of the conference. And to borrow a theme that my director, Nick, sometimes uses. You know, there have been folks from the federal level and definitely the state level here, and as a county in California, we provide the services in San Diego. I know some states provide direct services, but in our state, the counties do. And so in some ways, you know, you are our wholesalers, and I'm running a small shop. And I'm actually marketing and selling the products that you provide me. And I want to tell you a little bit how we're going about that and how it ties to what we're working on in terms of electronic information exchange. So San Diego has developed a strategic framework. It's a 10-year strategic framework, and you can see it's pretty lofty. We're talking about 3 main things: health, safety, and personal self-sufficiency. And so this is something that takes a population health perspective, which we think is important to really assess how we are doing as a region, to say, you know, what is the life expectancy of our residents? You know, do they have a long and healthy life? Are they able to be self-sufficient and, you know, live in a sense of stability? Do they feel safe in the community they live in? And, you know, to achieve those things which seem pretty fundamental, it really takes a mixture of services. So, you know, what I'm going to talk to you about is really the approach of how we've engaged in ultimately what is an interoperability discussion, but taking it from a level that really resonates with the consumer and, you know, even within our staff. So, just to tell you a little bit about San Diego, I know our size was mentioned. We are about 3.1 million residents, and that makes us a pretty large county. We're the 2nd largest county by population in California, and I believe the 5th largest county in the nation. We're larger than about 20 states, and you know, we have a heavy military presence, about 16 significant naval and military installations, and we have 18 federally recognized Indian reservations. And I tell you these these facts, not to say, we are different, but really to say we are the same. We have rural areas, we have a lot of independently owned farms, we're coastal, we're on an international border. There's a lot that can relate to every one of you. And so with that, where I work is at the Health and Human Services Agency, and we are an integrated agency. So our physical health, behavioral health, social services, public health are all under the same director, Nick. And we formed in 1998. And it's been a journey to really become truly integrated and move from just having departments sort of sitting around the same table to really integrated in the way we're providing services and tackling problems that our consumers face. And this timeline shows a number of things, but I want to highlight a couple. One, at the earliest side of the time frame, you see the Childhood Obesity Initiative. And we see this as something that was really fundamental for us. It was a game changer. It took place around 2004. And this was an effort where, as a region, there was really a cry to say, we are seeing obesity rise in the children in our region, and this is not okay. And this was an effort that took place that crossed beyond our local county government with nonprofits and really pulling together to say, how can we bend the curve on this? And, really beginning that private-public partnership and that collaborative led to other things. It also enabled us to look at the broader recognition of behaviors and how they impact health. So a couple of other things you'll see on here are that our Board of Supervisors adopted our Building Better Health strategy in 2010. And this was important because this wasn't just a Health and Human Services strategic framework. This became the entire county strategic framework. So our public safety partners, our general service partners, our purchasing and contracting partners, all the departments within the county now had this strategic framework that created this shared vision. And as a part of it, we did two studies. One was the economic burden of chronic conditions, and the other one was titled 3-4-50. And so these two reports really helped us to look in depth and quantify how those behaviors really impact lives in our region. And so the 3-4-50 really became something that resonated strongly with the community. And this is something that talks about that there are three behaviors, so no exercise, poor diet, and tobacco use, that lead to 4 chronic conditions or diseases: cancer, heart disease, type 2 diabetes, and lung disease, that result in over 50% of the deaths in San Diego County. And when we started parsing that even further, there were some geographic regions where it was 3-4-60. So this really became something that resonated with individuals, and it crosses a lot of boundaries, in terms of what are the social determinants of health, what are the behavioral issues around health. And I bring this up, and I know this is maybe a little bit of a different angle to come at an IT, electronic information exchange discussion, but I think it's important because this has really grounded our discussions. It can be tempting, especially, when you're starting to look at the data exchange projects at the local level. How are you going to really do this? People, let's get this done fast. Let's sit down and decide on the data fields we want to exchange. And, while that's tempting, that, it can create unintended problems, because you really have to look at what are you trying to achieve, so that then you can look at what are the transactions that give me leverage to impact these things, and then within those transactions, what pieces of information do we actually need to share and exchange, rather than starting just from, here's my list of data fields and here's yours and let's exchange. So really having this kind of common framework and this kind of common vision about, here are the things we need to impact to really make a difference in this region has been extremely important for this project, even though it might be classified as an IT project. Building Better Health, which really, is about the 3-4-50, has 4 pillars behind it: building a better system, supporting healthy choices, policy and environmental change, and changing the culture from within. And building a better system, we classify our electronic information exchange under this. It is called the Knowledge Integration Project because we see it as an opportunity to really share and integrate the knowledge that comes with the data and information to make a difference in the way we serve and approach our clients. And this is going to cross health, social service, behavioral health, and justice, as was mentioned. But it's really helpful to be grounded in the 3-4-50 so that we can look at what are the workflows that cross all these business lines, and then how do we design it as a unified business or a unified workflow. Very often, there's a workflow within each silo and then some form of handoff in between. And really, we're looking at this as one continuous workflow that we're designing across business lines, which for us, is a really new way to look at it. And so it's pretty exciting, but it's really important that we're grounded in sort of the same direction, when we're working with our partners at probation and, talking about alcohol and drug treatment, really grounding how do we impact these things and what transactions do we focus on. Healthier Choices is really about personal accountability and providing education and options. And some of the things we've been doing around that are more programmatic in nature, like getting healthy breakfasts in the classroom for kids. But these things all fall under this umbrella of building better health. And so for our agency, for our elected officials, and for incorporated cities within the region, this is really something that has resonated and kind of cleared a pathway to talk about data sharing and crossing business lines as we're working on these workflows and approaching the customer. With our policy, that's also kind of started to blur sort of traditional business lines. One thing that's pretty exciting is that we were able to engage through funding under Communities Putting Prevention to Work grant, our local, our regional planning entity, so that we brought together urban planners from the different cities and from the county to talk about how the built environment impacts health and incorporate health into their urban plans. So that was really, a step forward for us as a region, but it's all under this umbrella, and it's important to note because it's not going to be just the data at the end of the day that really moves the needle. It's a lot of these things, and it's really prepping the community, prepping the workforce to be able to exchange that information. And changing the culture from within, that really has been about workforce engagement, including, walking clubs at work, wellness, employee wellness programs, but it's really walking the walk. So how do you evaluate something like this? I mean, it sounds really great, but I've kind of mentioned like a little sampling of programs, including an electronic information exchange. How do you make it more than a patchwork quilt? And so, we knew that we needed to have a way to evaluate this, and that it had to really be broad enough to cross health, safety, and self-sufficiency. And so we looked to existing sources so that we could essentially steal, because that's a lot easier than creating from scratch. So we had some really great influence from the Measure of America, and if it's a report you haven't seen, I'd highly encourage you to look at it. It's an amazing look through data at the health and educational attainment of residents in the United States. And then Gallup's book, Well-Being, also looked at some of the social determinants of health, but looking at social connectedness and sense of community as an influencer on an individual's health, as well as the Blue Zones work and a number of other elements. In addition, locally, we have a report card on children and families, and the director of this report card, Sandra McBrayer, is she here? I'm over here. Yay. Thank you. This is something that has been in our region for a while, and Sandra's the key person behind it. And one of the things that has been really helpful is it provided us with a platform of using data to tell the story. The report card is really around children, but Sandra, I think it really comes down to relationships, and she has a way of making data interesting. So, not that it isn't, but it it can be difficult to get people to really engage around drilling into the data and really looking at that root cause analysis and, you know, what story is this really telling, you know, and so because of these existing platforms, as well as some of these reports at more of a broader level, we put together an evaluation framework that looks at life expectancy, educational attainment, financial self-sufficiency, community, and social connectedness. So, you know, the question that had come up about how will we know if we've succeeded with an interoperability effort, this is what we're looking at. We're looking at our community data to say, are we moving the needles? Are we bending the curves to really achieve long, healthy lives for our residents? And this also helps ground those discussions again about what workflows do you even begin to tackle when you're talking about sharing data. It can feel really huge and you can't boil the ocean. So how do you go about whittling it down to get that focus? And so really tying it to our strategic framework has been very helpful for us. This is a diagram of our logic model, so that really looking at, we're putting in certain inputs, and then there are intermediary outputs that are going to give us more near-term indicators of how we're doing to those ultimate outcomes. You know, community indicators and population-based indicators take a while to move the needle on. We don't want to wait 6 or 10 years to know if we're on track or not. That's a little too late. So how are we doing? We have some encouraging trends. So we've been working on obesity for about 10 years, and we've seen a decrease in the percentage of children who are overweight or obese. And that's really, really big, bad choice of words. You know, it's important to note because in so many other areas the trend is increasing. So, you know, we feel that this is a really encouraging trend. In addition, we're seeing encouraging trends around heart disease. So we have actually bent the curve enough that heart disease has sunk below cancer as one of the leading causes of death. And that is also really, really impressive to look at. But, you know, it's not enough to say, like, look at these trends in the community. Yay, we did it. We know that we need to develop more of a rigorous look at how did our activities influence these curves. And so we're going through a process now of really digging in deeper to say, how much did we influence that, and to what degree, and what other efforts going on in the community played a role? Because we really don't see it, you know, our county government as the single source of, you know, bending these curves. So to end the discussion, I put up this slide, and I know often, you know, we show the client in the middle. This actually shows an employee in the middle and really thinking about their workspace in sort of a, you know, a 3D, 360-degree realm. Because, you know, when we think about data sharing and the interoperability, you know, for us at a local level, what we were saying is, you know, if we want to really influence health, safety, and family self-sufficiency, we need context and information that really helps us to deliver the services in the way that those people need at the time they need it. So that requires bringing together information that we currently don't today, which is what, you know, we're all here talking about. And, you know, it's really going to enable employees in any department to be a health worker, to be, you know, a safety worker, and to really help build self-sufficiency. And so it's really a reframe of how employees are thinking about their role in the lives of families, and really an enabler of our strategic initiative, Live Well San Diego. So for us, really coming from the place of our strategic framework was really critically important to set that context for our own workforce, as well as in the regional community as a whole. We are moving forward with our electronic information exchange currently, and, you know, having the strategic framework helps in the areas of governance and all the way down to project management and setting your guiding principles for the project. So that's an overview of our strategic plan and how we're approaching electronic information exchange in San Diego, and why we feel it's a really critically important part of what we're doing. Thank you.
Well done.
Wow. I think any one of the speakers is well worth the price of admission, even if it wasn't free, Daniel. But to have all three, and for such different perspectives, and really so insightful. So we have a couple minutes for Q's and A's. And please open up the floor, and if anybody's got a question. I was impressed with wholesale, retail, looking at Nick, who isn't here.
That's a good thing.
But yeah, wow. So really amazing. With Olivia's presentation, I mean, I couldn't write fast enough, so I'm glad that Andrew, is that Andrew? Anthony, sorry, I know it started with an A. Did you get an A? But thank you for copying as much of that down as possible, because it seemed to me like it was the roadmap that we all really want to pay attention to. And then to hear Bill's discussion in terms of how to pull it off, and of course everything starts with MIDA, which is important. And to have his crew here is special too. So, questions? Yes, sir.
This is for Olivia. And you spoke about engagement of staff in the use of data, building culture.
That microphone would work better if it wasn't waving around.
Okay, how about that? Building a culture of managing with data. Could you elaborate that on a little bit, and kind of what techniques do you find effective in engaging at the staff level, at the office level? Because after all, this is where the information comes from. And if they're not engaged and connected, the likelihood of their keeping the data accurate, timely, drops considerably.
Well, let me offer a couple. I actually thought Carrie's presentation also offered ideas, and I suspect that Deb from Rhode Island might want to comment on the planning period there. I think that there are a bunch of strategies. So one of them is that the data you're collecting have to relate to a problem or question people have, right? And interestingly, at the beginning of work support strategies, that was one of the things our technical assistance was about. It was sort of, here are 5 questions. Why don't you go see if you can answer them from the data you've got? And I was actually interested in how useful that was to people. Program leads often were used to taking the data that was given to them and not quite being able to frame in their heads, wait a moment, I actually have a question, but it's a little different from that. And so going out and trying to answer real questions, and then that was really helpful. I also think that and this is something, Uma and I worked together long ago in the district, and one of the things that I learned there that was also true in some of the states we worked with here is that if the expectations of reward and punishment are not supportive of learning new things from data, that makes it hard for people to do it. And even if it's changed today, if for 10 years your incentive was sort of to not look too deep or use information to blame, then you sort of have to change that. And people have to genuinely start thinking about it. So my favorite, and then once the light bulb goes off for someone and they see that data actually answers a question they have and suggests an action that could make things better, that spreads very fast. So I'll give one example and then turn it over. In one of our states, where they were trying to understand, they'd had applications, but they'd never understood how new applications relate, what was a review, what might come out of churning, out of somebody's being closed. And one of the people in the state office reported getting a call from somebody in a county saying, I can't figure out what's going on. My county director, who was a political appointee of the county, came storming in because something because it looks as though our entire population is coming in to apply for Medicaid. And they went back and they looked at the data and they figured out that the reason it looked not quite literally the whole, but very large, was about the huge number of reapplications they had. And that kind of change, it helped everybody see that there was actually something important and useful here. I don't know, Carrie, I shouldn't directing, but I just thought your point about themes and focus and goals was so relevant too.
Sorry. here at a technology conference. Okay. I think that relevance is really important. And, one of the things that we've seen, in addition to some of the community data that really, it resonates and it tells a very personal story about your life expectancy and things of that nature. I think for employees on the job, some of the getting familiar and comfortable using data to make decisions, we've been using Lean Six Sigma to really look at process improvement. And so really being able to quantify problems that the employees have talked about and identified to really reinforce what they are saying has resonated. So that, we had a project that looked over an integrity report review process and found that it costs us more to just handle the overpayments than the amount we were actually overpaying. So, really to be able to say, you are right. It is costing us more just to touch these pieces of paper than we are overpaying. Something needs to be fixed. Really helps reinforce for employees the value of using the data. But it's a path. And really getting the data access takes time, So a lot of the effort that we're working on around the interoperability is to create employee portals so that they have greater access to work directly with it.
We're spending a lot of time on both internally in the Secretariat and externally on data. The internal piece is really report cards on agency performance, program performance, and so forth, and trying to get it to work its way up. And I think data can either be motivating or inhibiting depending upon what the individual has the ability to do with that information. And so to sort of create the relevance, one is there is data that should be public, and in the health field, I'll tell you, there's nothing like competition. How on earth did they do that to get people interested? And so that's a bias that I come with. And when we post in some of our programs, county performance or whatever, that does get people's attention. But even if it's, you only know who you are, you don't know who the rest are. There's creating the responsibility and accountability goes with it. We had an episode a couple years ago where we were having a particular problem, and there was a penalty financially from the federal government, but the state paid it. No part of it was paid by the counties who were offending. And by the state pays it, that means that the counties who weren't offending got away, helped pay for the counties that were not performing this function properly. And so I think we have to look at things like that. But the last piece is, okay, you give us all this information, what do we do with it? So I think the next challenge is to be able to actually say, by giving you this, we will also say you can do these types of things to fix or to improve or whatever, but just giving information without some structure is not always that helpful.
Yes, ma'am. Did you?
Hi, Deborah Carroll from DC. I'm curious, in the social service world, we historically never used data to manage our operations, and this is a huge culture change, not only from a management perspective, but also from, the folks on the ground and understanding how they can utilize data in order to make decisions. Can you just offer some tips on what tools you use to educate your staff as you started to begin to migrate into this new realm of data-driven processes? And I guess that's really it. Yeah. Tools.
I do think, and again, I'm going to get Deb in to elaborate on this a little bit, but I think that seeing something be different and having a picture in your head is extremely helpful. And so in a couple examples. In one of our states, there's a health and a human services department that are very separated. Some staff are co-located, but we went on a visit to one of those offices. They don't even share the hand sanitizer bottle. It has a label on it for who it is, right? One of those agencies put money
Could be a
into.
sign of trouble.
Well, that's what they're trying to fix. So one of those agencies put money into some very basic improvements in their system, like document imaging to get rid of some of the huge file cabinets and some other things. The workers in the other half started to see that, and that was one of a bunch of things that have over time led to the agencies connecting. Data, I mean, visits, well, in a number of our offices, and I think Deb may want to tell one of these stories, but a number of these states, going to another state and seeing, not just having your boss go, but having, I'm actually not sure we had line workers, but we had local office supervisors, seeing the way they could not have a backlog, not have a line out the door, use data to manage the transactions, suddenly gave you a picture that it was possible. And even if you didn't know how you were going to get there from here, you had a picture of what the end result was like that helped you get there. I don't know if you want to tell that story.
Deb, we want to give you the microphone, but we also want to just be conscious of, we probably have about one more question, then we want to take a break.
Okay. Perfect. I'll be quick. First of all, on behalf of Rhode Island, we're very appreciative to, number one, receive the planning grant, where we learned so much. And I think many of the people in this room heard me tell little stories yesterday about the site visit to New Mexico, and about the ACA toolkit that hopefully Alicia and Dottie are going to come to Rhode Island and share with us with staff engagement. So for Rhode Island, to be part of the Ford Foundation Work Support Strategies grant has been just unbelievable, and it will lead to change. So this is very appropriate. But I'll be really quick about the data. And I remember one of my first phone calls with technical assistance about the data was, I said to Dottie, my TA person, what am I looking for? I mean, we just did not look at the data, which is exactly what you said. Number one, getting our data is not easy, but we know, well, that's going to change. But we've learned through our technical assistance what to look at. And by the time the 1 year went by, some of the statistics we were able to provide in our action plan application was, we knew our churning number, which I'm sharing with my colleagues is like unbelievable. For most of our programs, 50 or 60% of our clients go off and come back on within 30 days. And without the guidance that we received in our planning year, we were not focused on that. So we learned that. We learned about our return mail. We learned about our EBT replacement cards. These are things that we just, number one, didn't know what to look for, didn't have the time to look for, and didn't have the focus. But by looking at that data, we could see a lot of stories, as you mentioned, Carrie. Now, where we're at a place is the staff engagement. And where we're at a place is where we believe once we begin to really engage our staff, and we did engage them to a certain extent in the planning year, but the validation of the things that they know and they see, we'll be sharing with them with the data, and then we're going to be engaging them completely to just fix all of this. So I hope that gets at some of... Great, thank you.
Just in the interest of time, I saw Brother Hansel, you had your hand raised?
Well, I think this is sort of a global question. So I think Bill and Carrie gave wonderful examples of Olivia's point, which is that it can't just be about interoperability or integration. It has to be about your vision of success and where you're trying to go and what you're trying to accomplish. And given that, I wonder if you have any thoughts that respond to Elizabeth's point that there isn't an advocacy community for interoperability. If we're going to carry this forward beyond the Affordable Care Act, beyond 90/10 funding, really to try to achieve the long-term goals that I think we're hoping to, how do you create, given your experiences in Virginia and San Diego, how do you create a community support base that will ensure that you can move this forward once those resources disappear?
I think there are actually a lot of advocates out there for results from certain programs. And what we want to see, for instance, in child welfare is permanency. And not really even being able to define which kids are permanent, what age and what interventions work makes it really hard to get there. So I think what you do is you say, all right, you work with the advocate groups who are interested in that, for instance, and say this is the goal we're trying to get. Now understand, the management piece of this isn't sexy. The results are, but we cannot get you that result without actually getting the processes in place that will get us there. You can't get prisoner reentry unless you have processes in place to get the information in advance and get the services lined up and get the housing and on and on. And it's not sexy, but it's what we have to do. So we have to have the dialogue with the advocates about to get the goal you want. There is a certain amount of work. Nobody votes for more for bigger budgets. Nobody votes for IT projects. We talk about wanting better government, but no one necessarily really understands what it is. So I think it's incumbent upon us to have a dialogue with advocates in specific areas to say, this is part and parcel of getting there. We can meet your goals, but you got to help us on this, because this is how we do it. That would be my...
And I would agree. I think we have many, many advocates, many, many partners who align with the vision, and that's what's key. The interoperability is the how. Long ago, you were getting around on a horse and buggy, and then the car, and who knows what's next. And so it's like not focusing so much on the how as the root of your mission, but it's really what's that end point you want to get to. And I think there's a lot of advocacy around that, and then that education piece around how these things interconnect. The social determinants of health.
Carrie, I'm pretty sure that neither David and I were getting around on horses and buggies. I just that bothers me.
I wasn't speaking personally.
Oh, okay.
Yeah.
I mean, the only thing, I totally agree with that essentially it's a piece of infrastructure and people have to be invested in the goal. But I think the other thing I would say is this is a unique moment because it's an expensive piece of infrastructure, right? Computer systems are expensive, and health reform, assuming it's going forward, offers this moment where where resources of a scale commensurate with a problem are actually on the table. And so while I think there are all kinds of reasons to think about how you would move forward after that and how you would build on that, I do think it's really important not to miss this moment.
Yeah, Olivia, I mean, health reform is important, but the 90-10, which buys you the pipes and the interfaces, is not tied to the PPACA, is not tied to the Supreme Court decision. So, I mean that's real important. You said it's health system reform gives the opportunity.
Well, it's interesting. None of my colleagues will give me an unambiguous answer, but I think we're all hoping.
Yeah, well, I think that is true. So, with or without, I think this opportunity remains.
And I would just like to support what Bill was saying, having been involved in getting the 90% and the A87. It's not dependent on the Affordable Care Act. There are certain strings associated with the 7 standards of conditions, one of which is interoperability with the exchange. But if the exchange doesn't exist for whatever reason, the administration has some latitude to interpret what does interoperability mean. And exchange was only one of several different partners, including Human Services and others. So I'm certainly hopeful, and we're counting on that it's being around. It was regulatory, not statutory, in terms of the change. On behalf of the audience as a whole, I want to thank Olivia, Bill, Carrie.